Assalamu alaikum. This is Amina, and I'm back with Wellness Compass. I know there's been a hiatus, but like all good things in life, especially with good doctors, there's always a long wait time. And the expert that I have today here with me is really good at what he does. Trust me, he was really worth the wait. Thank you, Dr. Avais Chatha, for joining me today. It's a pleasure to have you here.
Thank you so much. Pleasure to be.
So, And let me introduce Dr. Avais Chatha. He's a board certified gastroenterologist who started off his medical journey from a very prestigious institute in Pakistan, King Edward Medical University. And then he went on to do a postgraduate research fellowship in pancreatic cancer at Harvard Medical School. Then he went in to do his residency at NYU Winthrop Hospital and ended up with a fellowship in gastroenterology at the University of Mississippi Medical Center. And for the past 10 years, he's been practicing as a gastroenterologist. He owns his own private practice, leads an extremely successful gastroenterology practice, and where he not only focuses on gastroenterology and hepatology, but has a very, very avid interest in holistic and naturopathic medicine. Thank you, Avais, for joining us. As you may know, this program is basically designed which to serve as a personal guide for people while they navigate their own health and while they navigate their own health journey in this extremely intricate and confusing world of health. And there's so much wealth of information out there. It's really hard to tease out what's actually should be done or should not be done. And that's where experts like you come in. So thank you again for joining me. Pleasure to have you here. We'll jump right in. So I think that's a question that's very, I think it's on the top of everyone's mind is that why is digestive health even important? I mean, it's when we think of health, we some people think of heart, people think of breathing, but digestive health is not something that comes to your mind when you start thinking about health. So tell us why digestive health matters. Why should we even care?
Yeah. Thank you so much for having me, and it's a pleasure for getting this opportunity to kind of get out the information regarding this field. And it's interesting that you mentioned that unfortunately, digestive health is not as glamorous as cardiology or even ICU medicine like yourself. But I think it is getting a lot more awareness and respect over the years because people are starting to understand that there's not only a link to physiological well-being, but there's a definite connection in the gut-brain axis and how you generally feel in terms of your digestive health, along with a more psychosomatic, physiological, as well as psychological element to it. Now, obviously, as we get along, go along during this interview, we'll talk about the importance in terms of cancer screening and the pathological problems that come across. But I think nutrition, weight management, and overall digestive health for even your mental well-being is now coming into the limelight.
Yeah, and just going on from that, there are a lot of stomach issues, digestive issues that it seems like are preventable. Are there some that you would like to point out that we could do something preventive before they even become a problem? Since you mentioned that digestive health is coming more and more to the forefront now. So what are some things that people can do to avoid most common digestive issues?
So it's interesting that a lot of the pathology in GI is actually all preventable. Um, Majority of the pathology that we see and that affects people's lives is usually something that's self-inflicted to some degree. Whether it's fatty liver disease or acid reflux, constipation, and even colon cancer. To a certain degree, there's is a genetic element to these things, but there's also the environmental and habitual element that kind of exacerbates these conditions.
So another thing is that what I just wanted you to refer to a little bit to the warning signs that we should be looking for when it comes to digestive health, because I feel like they're more subtle than some of the other body systems. For example, if you're, for example, everybody knows that if you feel chest pain, oh, maybe it's heart attack, and if you're having difficulty with breathing, there's something going on with the lungs. But the warning signs for digestive health are not as prominent. So what are some of the things that people should look out for?
Sure. So, you're very right to point in that some things in digestive health can be subtle, and they can be as, simple as just not feeling well, having bloating, feeling slightly nauseous. Then, when you start going into the elements of the red flags, we
Hmm.
start seeing things such as unusual weight loss, difficulty swallowing. Obviously, when you ever see blood in the stool, that can be, pretty scary,
Yeah.
but also can be an indicator of something more serious. But, even the bloating and just general digestive um, unwell kind of feeling can lead to subtle signs of more serious conditions underneath.
Yeah, basically, so if something is persistent and not self-resolving and is becoming a bit of a concern, then you should seek help, right?
Sure. As subtle as change in bowel habits or
Hmm.
constipation or persistent diarrhea or a change from just your normal,
Yeah.
whatever it may be, can sometimes be subtle indicators of something that you should discuss with somebody.
Okay, sounds good. So, what are some of the everyday habits for a healthy gut? There again, like I said, there's a wealth of information out there. It's really hard to tell what is actually healthy or not. Every day you hear a new diet coming in, and then it becomes a fad, and then all of a sudden it fades away because it wasn't as effective as everybody thought. It wasn't the holy grail that everybody made it out to be. So, what are some of the actual healthy gut habits that people should adopt?
Yeah, I usually tell patients to try and keep it simple.
Okay.
Even when I talk to patients about weight management and how to, deal with obesity, I initially tell them to start with a calorie deficit. Just eat what you like, but start doing a little bit of portion control. But in the same line, keeping it simple, when you start doing things such as just increasing fiber in your diet,
Yeah.
leafy vegetables, fruits, oatmeal, things of that nature, limiting your red meat intake to less than maybe 18 ounces a week. All these things can have profound implications in your overall digestive well-being because everybody's heard of probiotics and prebiotics, and everything is kind of intricately linked because the food that you eat, especially fiber and yogurt and things of that nature, will provide the prebiotics that you will actually supply your gut biome, which will then overall work together for more digestive harmony and keeping everything, regulating well.
Okay, that makes a lot of sense. One other thing that people keep talking about and pointing out is, and it also comes up in a lot of health issues, is stress. Does stress or the state of mind affect digestive health?
I mean, like we talked about initially, the gut-brain axis is now really well understood. And
Hmm.
we know for a fact that increased cortisol levels in your body can definitely play a role in chronic inflammation. People are trying to understand in terms of even in longevity medicine and regenerative medicine, how the implications of chronic inflammation, high cortisol levels can affect your overall health. I think a psychological stress level will be a significant impact in even a digestive inflammatory state. So whether you have an underlying inflammatory condition such as celiac disease or ulcerative colitis or Crohn's disease, a psychological stressor will definitely exacerbate symptoms to a certain degree, not necessarily being a direct cause of it, but definitely does play a role.
Okay, yeah. It seems like there is a connection between the brain and the gut.
Yeah.
in the real sense. Um, you alluded to it a little bit earlier too, and I think it's becoming more and more um, commonplace, and we're discussing it more and more. But again, I feel like there's still a huge dearth of awareness as far as screening goes. So I would really like you to talk a little bit about that. What's the age when people should start getting screening? And I know it varies from risk factors and all of that. So if you want to elaborate on that a little bit, I think it'll be really helpful.
Yeah, I think that's a very important topic and a topic that's very important, significantly impactful in terms of affecting people's lives is colon cancer screening.
Hmm.
Colon cancer being the second leading cause of cancer death worldwide, unlike a lot of other cancers, it is very preventable. So the screening element comes here in multiple modalities. We think colonoscopy is still the gold standard because it not only is a diagnostic test, but a therapeutic intervention. And when we are doing a colonoscopy, we're looking for small spots in the colon called polyps. And these polyps take 5 to 10 years to turn into cancer. When we are doing a colonoscopy, we're not only looking for these, but we're actually snipping them out and therefore preventing cancer that would have occurred 10 years from now. There are a lot of other tests in the pipeline, but I explain to my patients that unlike other cancers such as breast cancer and prostate, where you have to screen early so that you can catch cancer early, this is something that you don't have to wait to get the bad news. And therefore, doing a colonoscopy is more beneficial than a Cologuard, which will be positive when something bad has already happened. And
Hmm.
in that light, I actually just did a case today where a patient had a Cologuard that was positive in the last 6 months. Patient came in to see me for rectal bleeding, and now they have a large mass in the rectum. So the problem with these other tests are that, there can be false positives and false negatives.
Yeah. So colonoscopy is still the gold standard, but I know there's a lot of hesitancy, especially if we really talk about South Asian population, where both you and I come from. People are really, really, really leery of colonoscopies. People feel violated when you even mention such a test. So how do you tackle that? What is your message to them?
Yeah, and that's a very important, point because, like I was mentioning earlier, it's not a very glamorous field.
Yeah.
Even my kids kind of joke around with the kind of job that I do. Um, and it's not only South Asian, population. It's females
Yeah.
have their own consideration. They'll generally want to try and look for a female
Yeah.
gastroenterologist, but
Hmm.
there's a significant deficiency of female GIs in our field. And then men have their own stigmas where they don't want other people investigating their, bottoms. So there is a lot of stigma to the screening when nothing bad is going on.
Yeah.
The problem is that in GI and digestive diseases, by the time you are having symptoms, it may be a little too late. And colon cancer, contrary to what people think, does not have any symptoms. So everybody, regardless of gender and age, ethnicity, at age 45, we recommend that they all get a screening colonoscopy. Now, if you have family history, obviously we recommend you get it a little earlier, but 45 for anybody who's average risk.
Okay. Yeah, and I was going to come to that people who have positive family histories or have a very strong family history of gastrointestinal cancers, colon cancers, or anything like that, should they be hyper vigilant? Are there extra steps that they should be taking to be super cautious other than starting the screening colonoscopy at an earlier age?
For sure. So I don't think that there's a lot of symptomatic vigilance that they can provide themselves.
Okay.
The main thing is that if you have a strong family history, you will want to get screened 10 years earlier than your first degree relative who had the malignancy.
Hmm.
Um, there are a lot of genetic tests now are available. So if your family member had colon cancer, usually these cancers are screened for genetic mutations, and those people will then be in a different category and will have different screening guidelines.
Got it. Okay, so also I know with every subspecialty and specialty, there are a lot of myths about things. And like, for example, passed down through generations, or my grandmother used to do that, or my mother used to say that or did that for this and that. So what are some of the myths, or what's the biggest myth that is prevalent in the GI world and which has no truth behind it?
So I think the number one myth that we try to tackle every day is that, you know, doc, I don't need to see you because I feel fine and I have no symptoms, so I don't need to do this. That is, I think, the number one myth in problems. Because by the time you're having symptoms in GI diseases, there is a significant progression that has already happened, and that makes managing that disease very difficult. So, colon cancer is asymptomatic. You will not feel anything. You will not experience anything. So, therefore, managing these preventative and therapeutic screening modalities at the right age is critical. But that's the number one myth that even primary care providers, have to be educated about.
Yeah, I agree because yeah, and sometimes they are enablers of that myth. They're like, yeah, yeah, you're right. You have no symptoms. There's no reason for you to see a gastroenterologist. Totally agree. Um, there are a lot of, and I briefly mentioned that too. There are a lot of other home remedies too. People are like, oh, hey, try ginger tea or try herbal tea or do this or take, ginkgo or bulba, whatever, all that kind of stuff. So is that also not helpful? Is there any evidence behind it?
So, I tell my patients that when they come see me, my goal is to have them symptom-free as well as medication-free. So I think there has been a significant awareness in the medical community that the pharmaceutical industry may not be as reliable as, previously thought. Not, you know, creating conspiracy theories here, but there's definitely good medications out there with purposeful use for them. But in general, I think natural interventions which do not cause any significant damage to the body, I'm always open to trying them with my patients. Simple as aloe vera juice for GERD or turmeric for IBD. These things are now pretty much well recognized in even the allopathic medical community as things that have good implications. And therefore, telling patients the simplest thing of how to change their diet, what non-inflammatory foods to eat, use blueberries for their antioxidant effects, use fiber for its anti-cholesterol effects and its prebiotics effects, aloe vera for coating your stomach, turmeric for its anti-inflammatory effect, curcumin. All these things are pretty valid,
Hmm.
and I'm always open for them to try these things. Now, in one sense, there can also be certain red flags, such
Yeah.
as, like you hear about kratom and kava and these new
Yeah.
herbs, which can actually sometimes lead to liver failure. And I've had young kids who've ended up needing a liver transplant because of herbal interventions that are not on any, founded data.
Yeah, and that's exactly what I was going to say before you mentioned that it seems like there's a very fine line, and it's really hard for people to know where to draw that line. Because like you said, I see sometimes patients who have like 15 over-the-counter medications listed where like, oh, I'm supplementing this, I'm supplementing that. A friend told me about this thing, or somebody from overseas is using this, and I would like to try that. So what I was trying to find out was that I know you have a special interest in naturopathic medicine too. So for people, I don't do it's not advisable to just pick something over the counter and use it. If they plan on using something, I think it would be a good idea to at least have a discussion with one of their healthcare providers to see if it's safe for them or not.
Absolutely. I think um, now because a lot more conventional allopathic doctors are also recognizing the value in the natural interventions that are out there. I think there's a lot of resources that are now being used to educate the new residents and fellows and even doctors who are in practice on what are the safe naturopathic interventions versus what can be risky and does not have substantial data behind it.
Yeah, agreed. And then, people sometimes tend to overdo it. They don't realize what are the actual constituents or ingredients of medications are. Like, for example, I have people come in who are like taking calcium from five different sources and they're like becoming hypercalcemic and they think they're helping their bones or improving their bone strength and something is doing something. So definitely, I think there's value to using such medications or natural remedies, but then they should definitely be discussed with your healthcare providers before you end up using them. Thank you, Avais. But one thing that I want you to end this discussion with is if you had like three tips for general public out there, what would those three things that you want them to do to improve their general digestive health?
I think the most important thing is realizing how much impact nutrition has. Not only from cancer prevention, but to the majority of the main GI symptoms that we see patients with, such as constipation, chronic diarrhea, GERD, acid reflux. I think the three main things would probably be definitely eat more fiber.
Hmm.
Any plant-based fiber source is never a bad idea. There's definitely data out there that even athletes are benefiting from a very plant-heavy, plant-based diet. Limiting your red meat intake to less than 18 ounce a week is definitely proven to prevent risk of polyps and adenomas and cancer progression. And stay hydrated. It's amazing how just water intake can regulate the enzymatic function of your physiology, keep you more regular, and also prevent acid reflux and a lot of other pathologies.
So everybody keeps saying, drink water, drink more water. How much is enough water?
So, I think general rule of thumb is about 8 glasses of water a day
Okay.
is the recommended adequate intake for an adult person, plus minus obviously a glass or so. And interestingly, the thing about colonoscopy that everybody hates the most is bowel prep.
Yeah.
So that is kind of the rule of thumb that we're using these days to decrease the volume of bowel prep that we use. And now what we do is a split prep in which we ask patients to have 32 ounces the night before and 32 ounces in the morning. And that's all that it takes. So generally, if you can drink about 64 ounces of water a day, then
Hmm.
colonoscopy prep is going to be a walk in the park.
Okay, that's good to know. So for all those colonoscopy, people who are scared of colonoscopy and colonoscopy preps, it's not as bad. It's not so bad. If you can drink 64 ounces, right? 64 ounces of water, you should be fine. All right. Thank you, Wes. Thank you so much. This was really helpful. I'm sure our viewership is much wiser in terms of digestive health. Their guts are going to be much healthier after this discussion, hopefully. Thank you. I really appreciate it.
Thank you. It was a pleasure to be here.